It's James with NetNewsLedger. Joining us by Zoom here in Thunder Bay is the Member of Parliament for Thunder Bay Rainy River, Marcus Powlowski. Welcome back, Marcus.
Hello, how are you, James?
Well, I think it was Bobby Kennedy was the one who said something about interesting times, and we sure as heck are. This has just been an incredible week here in Thunder Bay. We're watching 23 cases of COVID. We're watching some exciting announcements on broadband internet. And we've also seen a little bit of information of a possible vaccine that would get us out of this mess. What can you update our readers and viewers on? And I'll let you start where you want to go.
Vaccine would be number one of all those things, really. I think the announcement from Pfizer is just what we would hoped to have happened, which means early on in the trial, because in a phase 3 trial, you're only allowed to look at the data at some preset times along the course of the study. And then you either at that point decide, and sometimes if the treatment or the vaccine is clearly harmful, then you have to say something at that point. If it's clearly beneficial and it becomes unethical to continue the study, you have to say something at that point. And if neither of these happens, then it's study continues with no real comment. So the result seems to have been that this looks beneficial. The study continues, I guess, according to the pre-established rules until there's something like 160 people have become infected, but the results so far look really positive with no adverse effects. Now, maybe by the end of it, things are going to change, but I would say things look exceedingly positive about a vaccine. And if the initial reports of 90% plus effectiveness, this is phenomenal. I was really worried, and a lot of people were worried that the initial vaccines were going to be 60% effective, 50%, 70%, but 90% plus, especially if it got up to like 95% plus. I mean, this is phenomenal. It is the answer. It's the magic bullet. And now we're not quite there yet in determining that, but it certainly looks like that may well be the case, in which case there's light at the end of the tunnel, and that'll make a phenomenal change. Now, which leads us to story number 2, the large number of local cases. They seem to be related to each other. It seems like public health's doing exactly what they're supposed to, which is identifying cases and then tracing those to the people around them. So it seems like they're doing a good job, but certainly the concern is Thunder Bay will have a substantial number of cases. Now, what do we mean by substantial? You have to remember in places like Toronto, Ottawa, these are much bigger communities. So I'm not sure, and I haven't figured out if you translate their numbers to a place the size of Thunder Bay, how many people would that actually mean getting sick? But one way or the other, Winnipeg certainly has been bad lately. Winnipeg's been the hardest affected place in Canada over the last week or two. And if you look at COVID, generally, pretty well every place in the world who initially avoided it, who didn't have numbers, eventually it came around to them. So, and I think this was predictable that Thunder Bay was going to get some cases. Hopefully we can deal with it effectively. And here's, I think, what's important to realize, and part of the good story is the vaccine now seems to be on the horizon. So when we're asking ourselves, well, what do we do now? It becomes a lot more acceptable, I think, to us to say we're going to take the hit in terms of dialing back a bit on opening things, more social isolation, staying at home, not associating with other people, because, I mean, that's the right thing to do anyhow. But now, especially when we see a possible end to this, and they're talking about maybe by the spring, vaccine comes out, problems hopefully probably solved, that should then make it easier for us to accept, well, this isn't going to go on forever. Let's just do those things now to deal with the local increase in cases, to dampen it down again. Let's get back to low number of cases or practically no cases, and let's continue to do the things we've done to get to that point when the vaccine's out. And that was the whole plan to begin with. It just makes it a lot more palatable for us when we see an end. Before this, if this was 2 weeks ago, I think a lot of people would be saying, well, we're sick of COVID, we're sick of social isolation, social distancing. Screw it. I want to go out there and party and have a good time. I want to see my friends, because potentially this is going to go on for years, but now that isn't the case. So long-winded answer, but
No, that's good information, and this is one that some in the media and some others are finding it's hard to get answers. We're not giving out names of people who've been contracted the disease, and we're not giving their addresses. The health unit issued some updates today on some low risk exposures on an Air Canada flight and at one of the local churches. The information has been coming in. At one point, it's like a fire hydrant. It keeps coming out and it's hard to keep up with. And I think that's part of what's created, if you want to call it, a COVID fatigue.
Yeah, no, there has been COVID fatigue, and that's why this announcement on the vaccine is so welcome, because it's if you're in a never-ending race, if you're running a race and you don't know where the end point is, it's easy to just get tired and say, screw it, I'm going to walk. But when you know that the distance is, you only have another mile to go or another 5 miles, I mean, it makes it that much easier for you to kind of suck it up and deal with it, because there is an end in sight. And I think with this vaccine, I think there's an end in sight. And an important thing for us to remember too is, even though there may be a vaccine in sight, that all the more reason to maintain the social distancing, to be more cautious, because we don't want to be the ones or have our family members or our parents die just before it ended. So my mother, who's English, she had a cousin who was in the English army in the Second World War, and he died a week after the war ended, in the Burmese jungle, where they apparently hadn't heard the war was over. So similarly, it'd be such a tragedy for people now to be dying of COVID with an end in sight. Similarly, in terms of businesses and stuff, I think you have to look and say, well, the end's in sight. Okay, things are going bad now, but okay, as long as we can get to that end point, then we'll be okay. So I think that's psychologically really helpful, but also to remember, you don't want to be the casualty right at the end, just before the end, and that can and will happen if you're too quick to let down your guard and say, the vaccine's coming, let's go out and drink and have a good time. Well, that's when you're going to get it.
Now, one of the things that COVID-19 and the pandemic have shown is some of the shortfalls across the country. Anything that was weak can break, and the government announced broadband internet plans, in a very ambitious plan to put broadband internet to its 98% of Canadians. What do our readers and viewers need to know?
Yeah, it's 98% of Canadians by I think it's 2024. That's I'm just checking it. That was the announcement. So 1.75 billion in total. There's a number of different streams to apply. One of them is a rapid response stream, which I think the local projects that my understanding are in the works wouldn't qualify for. But my understanding is also that it sounds like the ministry may be willing to start off some of those projects under rapid response and then transition to one of the other programs as for further sources of funding. So absolutely, I think our government has realized, especially with COVID, but I think we knew beforehand that for so many things in life now, you need access to the internet. one of them to watch your show, right? Yeah. Anyone who's listening to this probably has internet access, but some people don't. But for the sake of their jobs, like a lot of businesses, obviously either primarily or largely function as a result of business generated online, but to make the connections with suppliers and things, to have the internet access is important, but also for education, especially now under COVID, if people want to keep their kids at home, but also university education. Certainly purchasing things, now Amazon doing very well, all those kind of companies, but also for social reasons to connect, especially in times of COVID, to connect with your family that you're unable to visit in Toronto or Vancouver or overseas. So I would not say that we've come to the point where we believe internet is a right. However, we may have come to the point where we think that any good government ought to assist all its citizenry to be able to access the internet, because it makes your life so much better, and I think probably makes you more able to contribute to society by running a business or by getting an education, which in the long run means that you have a source of income. You contribute to society through your taxes, so it's a good investment as well as being something that is desirable to make people's lives better.
It's interesting you mentioned about that, because if you think back to the Spanish flu influenza back, 100 years ago, there was no internet. How would you connect with anybody? How did you know what was going on? And today we're impatient. I mean, for NetNewsLedger, our slogan is news at the speed of the internet, but the internet keeps going faster and faster. And we're working hard to keep up. But I just can't imagine what it would have been like 100 years ago. Just getting the information that we get today so instantaneously. Back 100 years ago, if you were the member of parliament for what would have been Fort William riding, how would you'd be traveling by train, you'd be 3 to 4 days each trip, you'd be literally having to live in Ottawa, not Thunder Bay, but information would travel at the speed of the post office, basically. So we're a lot
Well,
better off today.
I think that was Marshall McLuhan. Media is the message, or medium is the message, which was it. But anyhow, the idea is that I think, if I interpret that correctly, that it's what is it? The medium or the media?
The medium is the message.
The medium is the message, and it is the medium, now I probably shouldn't have even gone here because I'm trying to interpret exactly what that means. But it does, I think, mean that our means of communication are totally central in our changed society, and certainly in this day and age with more rapid communications, it has changed the world dramatically in so many ways. Transportation being so much easier has changed the world in so many ways, because there used to be a saying that how fast can the fastest pandemic spread? Well, as fast as the fastest horse can run or the fastest boat can sail, because that's the only way that you would transmit an infection. So now with the speed of planes, that's how fast infections can spread. So that's why pandemics are so much a bigger concern. But also in terms of the medium and the message, is that things that we wouldn't have known before almost instantly now become public knowledge. So for example, racism. Nowadays, where everyone has a cell phone, a racist incident that happens in some other part of the world right away gets on the internet, gets out to a lot of people, gets to news media sources. And so there's this perception that, well, racism is getting a lot worse in the world because we're made more aware of it because of instantaneous communications. And my guess is that racism has not gotten worse. It's actually improved, although some people might want to quibble with me about it. But similarly, in terms of before, it was the idea that kids are unsafe on the streets playing with other kids. When I was a kid, when my parents were a kid, there was this kind of belief that nobody's going to harm your kids. They go and play. But when you start to get television and newspapers and things, then you're going to have stories that some kid somewhere was picked up by some stranger, and therefore our mentality starts to be, well, there's a lot of danger for any kid who's by themselves on the street. So the fact that news travels a lot quicker changes our perception about what is reality. Not that reality has changed, but nowadays with the speed of transmission of information, I think we're acutely a lot more aware of all kinds of issues that haven't really changed, but we're always there, but we weren't aware of it. And what you're saying, when we're kids and stuff, and there was only two, yeah, we didn't hear information right away, and so our lives were different. Were things really different? I don't know, but the fact that the medium has changed and the internet has changed our perceptions of all kinds of things.
Well, to shift a little bit on things, I mean, we're watching a political campaign in the United States that has wrapped up for president that has, it's like watching a soap opera.
Yeah.
President Trump and his Twitter account. I'm sure that there's people in the White House that would just like to glue his thumbs together, or some of the comments he makes. But, we watch things in real time now a lot more than we ever used to.
Yeah, no, I mean, it's all the message has become a lot quicker. And the other thing that's obviously changed is there's far more sources of information, whereas in the past, and that's one of the things with someone like yourself in a service you provide, in that I think the information you provide is hopefully um, fairly factual. It doesn't manipulate the news or the evidence, but certainly there are so many other sources of information out there which are questionable, and which do you decide to rely on? It used to be you had one or two TV stations in town, two newspapers, and 3 or 4 radio stations, and what was the truth? The truth was what they said was the truth. But nowadays, people have so many different sources of information they can go to, and they can kind of choose which one to believe, which leads, I think, to a lot of disinformation and a lot of people believing things which are not true at all. So it's not only is getting information a lot quicker and easier, but there's so many other sources of information of sometimes dubious quality. Although I would say, though, for the sake that, yeah, beforehand it probably wasn't good that there were like 3 networks in the United States or 1 network in Canada that controlled the truth, and that we interpreted the news solely through the lens that they applied to the news. And there is a lens, I think.
It's an interesting. We're headed tomorrow is Remembrance Day. It's going to be a different Remembrance Day because the services that we've normally live streamed for 10 years at Fort William Gardens, they're not happening. The outdoors aren't happening. So we've got a lot of things going on. And, the interesting part is that through preparing and doing some research for our Remembrance Day video that we put up, one of the pieces that struck me was that on D-Day, June the 6th, 1944, the first report that came out that the invasion had started was from German radio. It wasn't from the BBC. It wasn't from the Allied headquarters for General Eisenhower. The Germans started talking about the invasion, and all of the radio stations across the United States started reporting what the German radio was saying, but explaining that, okay, this is not from official sources. This is from the Germans. We don't know if we can trust it. And today in the media, as we head to Remembrance Day tomorrow, I mean, I don't think there's any World War I vets left. The number of World War II vets is dwindling, as are Korean veterans. Vietnam and Afghanistan and our peacekeepers, we owe a special debt of honor to those brave soldiers, sailors, mariners, women, factory workers. Even in the riding of Thunder Bay Rainy River, where the Bombardier plant is where the Hawker Hurricane that really helped in the Battle of Britain, that's where it was built. So we've got a long history here. And, Remembrance Day is something always special. And, that's probably get some words from you on that.
Yeah, no, certainly. And with respect to D-Day, my mother, when my kids did a project for school and they were supposed to ask their grandparents about what their one of their most interesting memories, and my mother, rather to my surprise, told my son that she remembered with going with her father and all her brothers and sisters down to the harbor in, I think, Bournemouth or Portsmouth, in England one evening, and she said as far as she could see across the harbor was full of boats, in war boats, and my grandfather said, tomorrow in the morning all these boats will be gone. That was the night before D-Day, and so amazing, and how many of those people died, and died basically to make the world a better place. But interestingly enough, yeah, the information didn't get out there. People like my grandfather knew that what was happening, but it was pretty solid that nobody revealed that beforehand. But yes, I mean, we are, and I talked about this in the challenge trial idea. We've kind of become a society which maybe we think way too much of ourselves and not enough about, and I think we're looking at the same thing with the acceptability of vaccines. We become a society which is far too preoccupied with ourselves, and doesn't spend enough time thinking about the greater good in other people in our society, and Canadians in general. And certainly our history, with the world wars, has been a willingness to sacrifice and to do things for other people. And I mean, partly, I think, not only does this make us a better country, but I think makes us maybe happier as people. I think people that are so self-absorbed with themselves are often unhappy. Whereas I think one of the greatest answers to depression is to stop thinking about yourself and start thinking a lot more about other people and what you can do for other people. I think people are happier being part of a society, and being happier feeling like you're contributing to something. So certainly in Remembrance Day, we have to remember those who did give their lives for the greater good, for other people, for our society, and that we owe them thanks. And we also probably, through our, and this is a doctor, someone who deals with death. I mean, now I'm only dealing with politics. but as a doctor, when you deal with death, I feel a certain moral obligation with the death is to try to make your life better as a result of that. I mean, it's hard to say that any good comes out of any death, but one thing I would say is that death ought to remind us of the importance of life, and the fact that there will be an end to our lives, and to enjoy the life while we have it. And so for those who've died, I think that's, in a way, I feel that ought to be an impetus for us to enjoy the lives we have as a result sometimes of those contributions, and creates, in my mind, a kind of an obligation to not waste that life, to live that life, and to enjoy that life, because people have died to allow us to do that. So.
And Marcus, I think on that, we'll wrap this week up. I've been talking to your staff to get you on every week so that we can keep everybody up on what's going on. And I want to thank you for your time this afternoon.
Okay. Thank you, James. Take care.
Take care.
Okay. Bye.
Excellent.